Good morning, everyone.
Good morning.
What a great turnout. Following the conference, this is just wonderful to have such a good crowd here today. So thank you, and thank you, Laura, for that great introduction to the day. So, this is a first, and I'm sure it won't be last. I'm not sure George wants to hear that, but we had a 2020 to 2024 dementia state plan. And we're here today to begin the process of updating this. Things have changed in 4 years, so we're really delighted to have so many of you to provide input. We want you to provide your insights and knowledge with the Alzheimer's Disease and Related Disorders Commission, with DARS, and with each other as we work together to build a dementia-capable Virginia. Remember those words. That's what we're all about today. As you just heard, there are many hundreds of thousands of families in Virginia living with dementia or milder cognitive impairment, and thousands more who are worried about their own cognitive function, what it might look like. I am. As many of you know, my husband, Jay, had Parkinson's disease. With that, he also had cognitive impairment. As such, I had a glimpse into life, what it's like to have dementia. But there is hope, as well as fear. Every month now, it seems there's news of new treatments that show promise after years of disappointment. We now know that there are lifestyle changes that we all can take to help reduce our risks of developing dementia. Even later in life, I guess we could start today. We can almost touch the day when Alzheimer's disease and other dementias will be treatable and even curable conditions, like so many other diseases that we never thought could be curable, and that medicine has conquered. But that day is not here yet. In the meantime, we need to ensure that families have access to knowledge, to resources, and to supports that can help them care for their loved ones who are living with cognitive decline and dementia. Again, that means becoming dementia capable. If a doctor tells a family that their loved one has Alzheimer's disease, some surprise, provides no follow-up resources, then we are not dementia capable. If a family cannot cope with dementia-related behavioral challenges and the person ends up in a psychiatric institution, then we are not dementia capable. If a family cannot navigate the often complicated system of supports and resources that are available or are not available, does not know where to turn, then we are not dementia capable. That is why the Dementia State Plan and the work of the Alzheimer's Disease and Related Disorders Commission are so important. Without a blueprint laying out what a fully dementia-capable Virginia would look like, then we are all essentially flying blind. The Dementia State Plan does just that. Its 5 goals, 14 objectives, and 71 recommendations and strategies that were laid out in 2019 reflected what we knew then and what has been achieved since the first plan was published 12 years ago in 2011. The plan must change and adapt to the knowledge, to the work on the ground, and to new opportunities. That's what today is all about. Thank you for being here. The Department for Aging and Rehabilitative Services is proud to support the Alzheimer's Disease and Related Disorders Commission, which since 1982, yes, 40 years ago, the Alzheimer's Disease and Related Disorders Commission has been working to advocate for services, supports, training, and development, really a better quality of life for those living with dementia and for their families as well. Under Chair Laura Bowser's leadership, over the past 4 years, the Commission has worked hard and smart to advocate for people living with dementia and for their families. It has sought to address the problems highlighted by the disproportionate impact of COVID-19 on people living with dementia and on their families. Going forward, the Commission will be doing this with even greater engagement from key state agencies who serve and support these Virginians. Legislation was passed just this last General Assembly session so that starting July 1, the commissioners of DARS, the Department for Behavioral Health and Developmental Services, the Department for Social Services, and the Virginia Department of Health, as well as the Director of the Department for Medical Assistance Services, or their representatives, will be joining the Commission. Who would have thunk we weren't all involved previously? We look forward to being better integrated into the Commission's work and see this as a vital step forward towards the whole of government approach that is needed to tackle this important issue. But the Commission does not work in a vacuum. They must hear and learn from you, the stakeholders, the boots on the ground that are doing your utmost to support families and individuals living with this very difficult disease. That is what today is all about. Thank you for being here. Of course, this is not a one and done. As I said in the beginning, the Commission and DARS see the summit as a continuation of efforts to date and the start of another phase in building dementia capability into everything we do. The Commission plans to attach a work plan with measurable outcomes over the next year. This will be a first for Virginia's Dementia State Plan. You will hear more about that later. So in your breakout sessions later today, I encourage you to think of concrete and measurable strategies and recommendations that should be included in the plan. Without you, the plan is meaningless. With your help and input today and in the future, the plan can become a reality. So thank you.